Great deal of style. Thank you so much for letting me present to you this afternoon AB 2119. This is an important bill that would ensure transgender and gender nonconforming youth in our state's foster care system have access to appropriate health and behavioral care services. Unfortunately, I think many of the senators here know that our transgender and gender nonconforming youth are significantly overrepresented in California's foster care system. And unfortunately, bias and misinformation creates barriers where these children are unable sometimes to receive medically necessary care that they need. Current law requires the child welfare agencies to assess the health needs of all the children in their care and to ensure that they receive appropriate care and timely care to address the needs identified by qualified professionals. AB 2119 requires child welfare agencies to provide access to clinicians who provide gender-affirming treatment consistent with the established standards of care. Now, I want to emphasize, because this has been brought up in other settings, I want to emphasize that gender-affirming healthcare and behavioral care is subject to the same rules governing consent for other medical and behavioral health care for youth in California's foster care system. There are no special rights being asked for today, senators. What we want to do is make sure that the children who need it get access to gender-affirming care because it is so very urgent. Some of you may know that for adolescents in particular, withholding it prolongs and exacerbates gender dysphoria, contributing to an appearance that may provoke abuse and stigmatization, things that all of us should be opposed to when it comes to our children. With the high frequency among transgender youth of mental health challenges, including anxiety, depression, social isolation, self-harm, drug and alcohol misuse, many providers view early treatment as nothing short than life-saving. This bill will ensure that our transgender foster care youth get the care that they need to lead healthy and productive lives. With me this afternoon, I have two witnesses, Dr. Jennifer Hastings and Joe Michael from Equality, California. If I may, I'm going to turn it over to the witnesses.
Please do.
Glazer?
Yeah.
Thank you so much. There we go. My name is Dr. Jennifer Hastings. I'm Assistant Clinical Professor at the UCSF Department of Family and Community Medicine. I'm also on the Medical Advisory Board of the UCSF Center of Excellence for Transgender Health, and I'm Program Director for Gender Spectrum. So I have been providing gender-affirming care for youth and adults since 2003 intensively, and I can tell you that supporting appropriate access to gender-affirming care for youth in our foster care system is critical and will improve the stability and the long-term health outcomes of our most vulnerable children. I think you stated the situation very clearly, but I want to say that I have taken care of foster youth who really struggle to access care in their counties, and this affected them negatively in their mental health and in their medical health. This was never acceptable, and this AB 2119 provides the opportunity to actually clarify current law, ensuring access to appropriate care. Withholding behavioral health and medical care has worsened the health of our foster youth, increasing, as you stated, depression, anxiety, and suicidal ideation, and has resulted in actual suicides. Current research shows that delaying or not providing care for our youth is not a neutral act. Suicide and self-harm increase when transgender and gender-expansive youth are unable to access care. Truly, as you said, this care is life-saving. The American Medical Association, the American Psychiatric Association, the American Academy of Pediatrics, and the UCSF Center of Excellence for Transgender Health, as well as many other professional associations, recognize that access to gender-affirming behavioral health and medical care is critical to transgender and gender-expansive youth. We are guided by standards of care from the World Professional Association of Transgender Health and the Endocrine Society Clinical Practice Guidelines, just published in 2017, which emphasize an individualized approach to care. Those that oppose this bill cite outdated and inaccurate research steeped in bias. All youth deserve educated and knowledgeable professionals who support youth and our families. The children of California, and in fact all Californians, deserve timely, evidence-based, gender-affirming care, and AB 2119 provides the needed support for our most vulnerable youth. Thank you so much.
Thank you. Next witness. Good afternoon, Senator and Committee. Joe Michael for Equality California. We're proud to be a co-sponsor of this bill. There was a young person who is a former foster youth who was going to be here and testify today, but unfortunately they are having health problems and were not able to be here. So if you all will bear with me, I will briefly read a bit about this young person on their behalf. Phoenix Moncada is a former foster youth. Their mom was in the child welfare system herself. When she became a parent, she did not have the tools to be an emotionally, mentally, physically available parent for her children. Phoenix was a month old when they entered the foster care system. They were initially placed in a group home and then in a foster home. Phoenix was 16 years old when they first tried to access gender-affirming care. At the time, Phoenix was living in a group home, and their group home and all providers, unfortunately, were unsupportive of Phoenix's gender identity and would not connect them to gender-affirming care. Phoenix was able to connect with the LA LGBT Center's RISE program. Los Angeles LGBT Center is also a co-sponsor of the bill, just to note that. They provided gender-affirming care to Phoenix at the group home where they were. With RISE advocating on their behalf, they began to access support groups, became able to socially transition, and could schedule an appointment at last with Children's Hospital of Los Angeles to access care. Phoenix was depressed when they weren't able to access gender-affirming care because they felt they were being denied who they are. They felt lost, misunderstood, and misled because people would tell them to do things that made them happy, but when they did express wanting to transition, people disapproved of that. It left Phoenix feeling confused, and that was only alleviated when they were finally able to access gender-affirming care. Thank you all for bearing with that and listening to a little bit of Phoenix's story, even though they were not able to be here. We urge your support for this bill today. Thank you.
Thank you. Are there other witnesses in support? Please come up to the microphone. Just give your name and your identification and your support for the bill.
Becca Kramer-Matter on behalf of the ACLU. We are also proud sponsors of the bill, and our three other sponsors in addition to EQCA, LA LGBT Center, Lambda Legal, and National Center for Lesbian Rights also asked me to express their support, as did Transgender Law Center and National Center for Youth Law, who are also in support. Thank you.
Thank you.
Angelique York with National Association of Social Workers in support.
Thank you.
Sherman Goldblum on behalf of the Western Center on Law and Poverty and Support.
Thank you.
Lydia Bourne, California Division, American Academy of Pediatrics in support.
Thank you.
Kim Lewis with the California Coalition for Youth in support.
Vanessa Hernandez, California Youth Connection in support.
Danielle Mollet, California Alliance of Child and Family Services in support.
Kat DeBerg, Health Officers Association of California in support.
Kelly Brooks on behalf of the County Welfare Directors Association and the Santa Clara County Board of Supervisors here in support.
Thank you.
Shanti Ezrin, the Alliance for Children's Rights, we're in support. Thank you.
Jen Rexrode, California Alliance of Caregivers in support.
Susanna Niffen with Children Now in support.
Lucy Salcido Carter with the Youth Law Center in support.
Paul Yoder, City and County of San Francisco in support.
Thank you. Any other witnesses in support? Last call, as our acting chair would say. Okay, are there witnesses in opposition? Please come forward. All right, we'd like to invite two of the witnesses in opposition to address us. 3 minutes each, I think is the committee rules.
My name is Dr. Andre Van Mol. I'm a California family physician. My wife and I are 9-time foster parents, and I also represent the American College of Pediatricians. I'm asking you to oppose AB 2119. The state is mandating that foster children with gender dysphoria be exclusively what they call affirmed into treatment protocols that actually lack proven records of benefit or safety because of a condition that usually goes away on its own. Gender dysphoria, transgenderism, has an overwhelming probability of resolving on its own. The medical literature says it does so 80 to 95% of the time by adulthood. Underlying issues are what need addressing first. They can be many, and foster children are far more likely to have them. It's so simply because they're foster children and what put them into the system in the first place. The American Psychological Association's Handbook on Sexuality and Psychology specifically warns against a rush to affirm or transition because it risks neglecting these underlying psychological issues. And yet, this bill says rush. The Endocrine Society guidelines state psychological intervention is all that is needed in some forms of gender dysphoria. This bill says no, not enough. The risks and permanent consequences of a minor undergoing transitioning are sober. It makes someone a patient for the rest of their life, and kids cannot grasp that. There is no medical proof of the long-term benefits or safety of a child undergoing hormone therapy and surgical transitioning, so it's impossible to scientifically recommend this pathway to minors. Hormones are actually not FDA approved for this use. I would submit that the bill's not pro-science, it's actually no science. Regret is not rare, but what's gone is gone. A 2011 Swedish study looking at post-gender reassignment adults showed a completed suicide rate 19 times that of the general population. I submit to you what's being proposed makes things far worse, not better. Last 2 points, if I may. Children have developing brains. I know this as a physician, I know this as a foster parent. Their minds change often. They don't grasp long-term consequences. Children should not be pressured into making permanent decisions that alter their bodies. And finally, people of faith help keep our troubled foster system afloat. Passing another bit of legislation telling them they're really not welcome is not going to be a help to the system. I thank you very much for your kind attention.
Thank you. Next witness.
Hi, my name is Hachi Horvath. I live in Fairfax, and I recently retired from UCSF, although I'm still an adjunct faculty member in the Department of Epidemiology and Biostatistics. And I've got three kind of areas of expertise here. I'm an expert in assessing the risk of bias in scientific research studies, and also in the overall quality of evidence for any given research question in healthcare interventions. Member of the GRADE working group, and I was closely associated with the Cochrane collaboration for over a decade. Secondly, I myself used to be transgender. So from 2000 to 2013, I lived as a woman. I was actually quite happy until I went off estrogen because of the strong risk, not strong risk, but it's a good risk of, risk worth considering of blood clots. And I'd been on it for many years, and I stopped, and within a month, I was like, I'm over this. That's it. And it was amazing because I was so into it. And thirdly, I myself was in foster care. I grew up in the chaotic late 60s, early 70s. Things were pretty crazy. And we got put in foster home several times, and not for very long, a few weeks. But it was enough that I knew the anxiety and the feeling freaked out. Am I ever going to see my mom? Or am I going to see my friends? Do I have to live over in this town now? And you have no idea when you're a kid what's going on. You're suddenly shifted into a new place, and it's confusing. Anyway, through my experiences in life with chaos and drugs all around and violent people and violent men and just being in that milieu, I sort of dissociated and had a kind of a fragmented self where I felt like I'm really a girl, you know, because I identify with my mom, and all these men are just violent idiots, and so I had a kind of a secret kind of thing going there, and you know, and they're in the foster home too. I had that. So what I'm saying is that kids in foster homes are kids in trouble quite often. You know, they come from really difficult backgrounds, and it's painful. It's painful back home, and they still want to go there just because it's familiar, and it's not an easy thing. But what I'm saying is that they might act out, they might come up with some kind of a coping thing that I'm transgender, and it's not to be forgotten that there's currently an epidemic going on of rapid onset gender dysphoria, and it's only beginning to be talked about. There's recently a paper from Finland remarking on the fact that it used to be by far fewer girls would say they were transgender. Now it's the majority. And rapid onset gender dysphoria is a phenomenon in which through social media and sort of social contagion among their friends, they suddenly decide with no previous history of saying, I'm a boy now.
If you can try to wrap up.
If they're a girl. Okay. So when we talk about affirmative care, we have to be clear that we're talking about giving them puberty blockers. This is not just like giving them psychological support. Affirmative care means, all right, so let's get you on the puberty blockers. And if you're 13 or 14, we'll put you straight on the hormones. That's what they're doing in California. They're doing mastectomies on 14-year-old girls in California, in Los Angeles right now. And that isn't right. And that's what's going to happen. It's a very, very slippery slope. And I tell you, it's not just going to be, give them a therapist. Give them a therapist. They need all the support and help they can get. And give them any medical care they need. But why can't they wait a little bit until they're grown up? It's a few years, and then they can figure out what they're doing.
Okay. Great.
Thank you.
Thank you for your testimony.
Thank you.
Are there others who are in opposition to come to the mic and give us your name? Yes, yes, sir.
Yeah, my name is Dr. Michael Laidlaw. Thank you for having me. I'm a physician. I'm an endocrinologist, which means I specialize in the study of glands and hormones to treat patients with these conditions. I'm very concerned about AB 2119. On the one hand, I'm glad that people are considering the unique situations of foster care children and that they need help. The part of the bill that concerns me the most is this: a licensed professional or other individual should not subject a foster child to any treatment, intervention, or conduct that seeks to change the foster child's identity. My concern has to do with these hormones. You have to understand what's going on with these hormones if you're going to make an informed decision. These medications, as Hachi said, are called puberty blockers. These powerful hormones act directly on the pituitary gland and stop puberty. This means that most of a child's body will continue to grow into an adult, but the sex organs will be stunted or frozen in time, if you will. Eventually, children are put on hormones at an early age of the opposite sex. Stopping puberty early leads to complete sterility, complete infertility, and also, which is little known, sexual dysfunction. Estrogen, for example, will not develop the male child's genitalia. If the child goes on to have surgery to make a sort of vagina, even at age 18, they will still have the tissue there of a 9 or 12-year-old. So they will have limited to no sexual function, and there's already evidence of that out there. They will not be able to reproduce because the organs have not developed, in the case of a male, sperm that could even be sperm banked. So causing foster children to be sterile and have sexual dysfunction is a major concern, I think, of everybody. They don't have the capacity at that young of an age, maybe when they're adults, to understand what's going to happen to them.
If you could try to sum up.
Sure. The doses of hormones also given to make the opposite sex are very high. To give you an idea, females changing to males are recommended to be given between 30 to 80 times higher levels of testosterone that would normally occur in their body, and there's great risk from that. Please do not pass this bill. Please go back and think this over very carefully, look at the science carefully, get other medical opinions before passing this bill. You can save the health and lives of many foster kids by doing so. Thank you very much.
Thank you very much. So at the microphone, if you can just give your name and affiliation, if any, and in opposition to the bill. Our general committee rules are only 2 witnesses in opposition that provide extensive testimony. We've had 3 here today, so go ahead.
My name is Freddie Hillary. I'm pastor of Shiloh Tabernacle Church in Rancho Cucamonga. I strongly oppose this bill and consider it communistic. Thank you.
Thank you.
My name is Shane Gray. I'm also a pastor in Rancho Cucamonga at Shiloh Tabernacle, and I oppose this bill.
Thank you.
Hello, my name is Drake Mackin, and I'm a youth pastor at Shiloh Tabernacle, and also against this bill.
Very good. Thank you.
McNichol, oppose.
Thank you, Stan.
Good afternoon, senators. Thank you so much. And Janet Nguyen, hi, Orange County.
Anyways, just want to say I oppose this bill. Thank you.
Hi, I'm Krista from Placer County, and I just wanted to say that I oppose this bill. Thank you.
Thank you, Krista. Anyone else who hasn't had an opportunity to speak in opposition, identify themselves and speak in opposition? All right, so we're going to close the public testimony element of this and bring it back to the committee. There are committee questions? All right.
I just have some comments, but I can hold
Why don't
until
you
you.
just hold it just 1 second?
Sure.
I'm going to give the author, Mr. Gloria, a chance to respond to anything that he's heard thus far. And
there's not a great need to respond, Senator. I think the comments on both sides speak for themselves. You look at organized health professionals, social work professionals, people who work in this field with educational backgrounds and contemporary data and information. They are supporting this bill. I respect the people who are here in opposition. I respectfully disagree, and I strongly reject the notion that people who are transgender or gender non-binary will just simply grow out of it. I think about 10 or 15 years ago, someone probably was sitting here and tell you that I would have grown out of being gay. None of you would accept that as being a fact. I would encourage you to think of it in that same way. People are born this way. Whether or not we allow children who are in the state's care to have access medically necessary treatment is the question that's before you today. I do not know how you could look at any of these children and deny them that opportunity. And this is not done on their own. These are not 5-year-olds making healthcare decisions for themselves. This is done in concert with parents and with medical professionals like any other medical procedure they're allowed to under the law. I think many of the comments today illustrate the fact that many of these children go without, not because they don't need it, but because of the bias and misconceptions of the people who are placed in their care. I ask you for your support for the children of California. Thank you.
Okay, I'm going to look to committee members for additional comments. Senator McGuire.
Thank you so much, Mr. Chair. Appreciate the author bringing this forward and for all of his work on this, and I do appreciate those who traveled far and wide who are opposed. Just some very quick thoughts, Mr. Chair. This bill is simply to guarantee transgender youth, foster kids, our most vulnerable in the state system, access to health care. That's it. Access to health care. If they want access to health care as a male, we should give it to them. If they want access to health care as a female, we should supply it. There is a significant number of foster youth in this state who identify as LGBTQ. And these foster youth face suffocating depression in many cases, abuse at school, and much higher numbers of suicide. And there's a reason for that. I think that this state needs to provide health care for all, and it needs to start for those kids who are under our care. No matter if you are a male who identifies as a female or a female who identifies as a male or non-binary. So I appreciate the author's work on this. I know that it's been difficult. I know that we may not all agree in this room, but this is a bold step and the right step. And if we truly want to continue to advance reforms in the foster care system, we should continue to focus on psychotropic drugs and the over-medication of our youth. And that is one of the biggest challenges that face foster youth in our foster care system. So again, Mr. Assembly, thank you for all your work.
Thank you, Senator McGuire. Any other comments or questions from committee members? All right, Assemblyman, I want to give you the opportunity to close, and as it's apparent to you, we haven't established a quorum yet in our committee, so we'll wait until that happens to decide the fate of the bill. But would you like to close for now?
Senator, you've been extremely generous with the time of the committee this afternoon. I simply ask for your aye vote.
Great. Well, thank you very much. Thank you all for testifying for and against, and we're going to hold that bill until we get a quorum, and we can go from there.